delegates, on behalf of Zenit team, I, Dr. Nishan from Medical Affairs team, take the privilege to welcome all of you to our virtual scientific forum called Endocrine Talk Show. So this is a unique scientific platform and we are running the 13th episode. And so far we have received an overwhelming response for this very interesting platform where we have multiple stakeholders from different specialties talking on some very important topics with regards to panel in the format of panel discussion. And today's topic is also one very fascinating topic, which is doping in sports. And for that, we have some galaxy of eminent faculties from different specialities to give justice to this very important topic. So, just to give a brief overview of this fascinating topic, throughout the history, athletes have been willing to ingest just about anything to improve their performance on the field. So, if we give the historical aspect, some ancient Greek used to use turn to figs, and some even use mushrooms. But from that, we have come a long way. Now, the performance enhancing substances are a lot different, which are hormones, blood boosting erythropoietin, and very recently now even gene therapy. So certainly we have gone a long way. And there are throughout the history in the Olympics, there have been multiple scams which is related to the doping. Most famously, the Lance Armstrong, who took the erythropoietin. So there are various such examples, and right now the way things have advanced, even to diagnose this substance is also a very difficult thing. And what has been now identified that this is not only difficult to diagnose, this is very difficult to curtail. So doping in sports is going to continue, and so the ways to how to control will also need to be evolved. So with that background, I would like to introduce and invite our course director and moderator, Professor Shubhankar Chaudhary. So Professor Shubhankar Chaudhary is one of the most eminent faculty when it comes to endocrinology, who does not need any introduction to our scientific community. But as a customary, I will briefly introduce sir. So he's a professor and head department of endocrinology, IPG, MER and SSKM Hospital, immediate past editor-in-chief, Indian Journal of Endocrinology and Metabolism, past president, Endocrine Society of India, and he has various publications, more than 220 in various national and international journals. So with this, I would request sir to have the virtual podium and introduce and invite our other faculties which are from different specialities. So we are quite privileged to have to be hosting such galaxy of eminent specialities and the doctors. Over to you, sir.
Thank you, Dr. Nishant. It's a warm welcome to all of our participants across the country. And this time, this is the 13th episode of this Endocrine Talk Show, and we know the topic now. Let's get introduced to our panelists, our experts, who actually hold the attraction for this program. So this time we have not only endocrinologists, but also people from other specialties. And first of all, we will introduce Professor Bikash Mehdi, who is professor in the Department of Pharmacology at PGI MER Chandigarh, who is editor-in-chief of Indian Journal of Pharmacology, International Journal of Pharmaceutical Sciences and Nanotechnology. And he is especially relevant in today's discussion because he was ex-regional coordinator for NADA, which is the National Anti-Doping Agency for North Zone, which comes under the Ministry of Youth and Sports, the Government of India. So a warm welcome to Dr. Bikash Mehdi. We also have our very own, very dear friend, Dr. Bipin Sethi, who is consultant endocrinologist and head of the department at Care Hospitals in Hyderabad. And he's an excellent orator and a charming person overall. He was the recipient of Economic Times Inspiring Doctors of India Award in 2018. We also have in our midst Dr. Sanjay Varada, who heads the Department of Endocrinology, the prestigious Department of Endocrinology at PGI MER Chandigarh. He is also currently the president of the Endocrine Society of India, and his areas of interest, of course, diverse, but mainly metabolic bone disorders and diabetes. Next, we have Dr. Arpat, who is friend Manipal Hondule, and he has 7 publications to his name. The youngest, but probably the most important member of this evening's faculty is Dr. Shubhankar Kumar, who is Associate Professor in the Department of Physiology in our institute, the IPJMER, Kolkata. So, welcome to all our panelists. Again, welcome to all our participants. As we have already heard, that doping in sports is widespread, and doping related scams are there, so many of them. And of course, Dr. Nishant has already mentioned about Lance Armstrong, who was a great cyclist and was possibly adulations were even more after he won, I think this for the 6th or 7th time, the Tour de France, after battling over testicular cancer. So as a cancer survivor, he went on to win another Tour de France medal. Then we have Ben Johnson, at one time the fastest runner in the world. He clocked less than 9.9 seconds in the 100-meter sprint in one of the Olympics. Then we have Maria Sharapova, who is not only a great tennis player, but also a fashion icon, who was also caught up in this scam of doping in sports and also lost titles, straight off a title, Olympic title. So what people do want, of course, they want to perform better. And what, of course, the rest of the world wants is to have a level playing field so that some people do not get undue advantage by taking use of specific drugs. But we as physicians are also concerned that the doping agents could lead to long-term health disadvantages. So these are the areas that we should try and cover. But before that, I think what's very relevant to understand is what are the effects of physical activity on the endocrine system. And we have eminent person, a physiologist, to tell us. So if we are using some hormones, are there major changes that we can bring about in order to improve performance in sports? Dr. Shubhankar Kumar.
Thank you, sir. The main effect of exercise on metabolism, we have the athlete's paradox that muscles of marathon runners accumulate lipid droplets so that their metabolism is more aerobic. They have a very high anaerobic threshold in addition to a very high VO2 max. Coming to endocrine effects, much of the endocrine effects of exercise or physical activity is like a stress response. Say at 25% of VO2 max, you have ACTH increasing. At 50%, you have circulating norepinephrine increasing that indicates sympathetic activity. And at 75% of VO2 max, you have adrenaline. At or around the anaerobic threshold, both growth hormone and prolactin increase. This is the acute effect. Interestingly, exercising for 1 year daily above the anaerobic threshold, just above the anaerobic threshold, also increases the resting pulse amplitude of growth hormone secretion. So that is a long-term effect of aerobic training. How it helps the body I don't know, but that's a finding.
Okay. And when we talk about doping, it's for certain sports, certain doping agents are common. For example, for weightlifters, anabolic steroids are widely used. Whereas in cycling, as Dr. Nishan Dalal referred, blood products, erythropoietin, are more widely used. So, is there a physiological basis that we use different agents for different types of sports in order to improve performance?
Yes, sir, definitely. Blood doping definitely increases, oxygen carrying capacity increases VO2 max. Interestingly, Lance Armstrong never produced lactate. So that was a puzzle to physiologists. Later in 2007, he confessed to erythropoietin doping. And in fact, his hemoglobin was almost always above 15, in the range 15 to 16, like that. His hematocrit was less than 50%, but not exactly 50%. So he did not have that much viscosity problems, and he just did not produce lactate. So that shows clearly that.
Right. So, yeah. So what I'm asking is, so why should blood doping be used specifically by cyclists? Why not by the sprinters?
Okay, the 100-meter races are mainly anaerobic. Of course, you need to deliver blood supply to the exercising muscle, but the anaerobic power is more important in sprint in 100-meter races.
Right.
So anabolics could have an effect. Then anabolic steroids are most beneficial to bodybuilders.
Right. And
how much it increases, how much anabolic steroids increase strength is an open question, and how it translates to performance is unsettled.
Okay, right. So I'll once again appeal to all the participants to put in your questions in the chat box while we go on chatting amongst ourselves, but we'll try and address all of your concerns. So we come to
just
Dr.
one more.
Yes, sorry.
Just one more issue. Beta blockers reduce physiological tremor, and that is a definite advantage in shooting and archery.
Right. Sure. So we did hear that it's an open question whether actually these agents improve performance. So let's try and close the question with Dr. Bipin Sethi. So many agents are used, and athletes believe, their coaches believe, and they go to any lengths actually to procure these agents. So are they actually beneficial? Are they actually performance enhancing agents? Dr. Bipin Sethi.
Yeah, well, I think they are, because if they weren't, then they wouldn't have been used. If you look at the people who come to your clinic and who've been bodybuilding, as Dr. Subhankar said, their muscles are distinctly different, and they are also able to improve their performance. It's very difficult to do a controlled trial to see what is the impact of these hormones, but basically the exercise performance or enhancement depends upon the improving this blood supply, improving the cardiac tolerance, and also the muscle mass and muscle energy utilization. And if you use anabolic steroids or use erythropoietin or other agents, these things are going to increase the muscle bulk, muscle oxygen delivery, muscle performance. And therefore, the short-term impacts, or at least short-term impact of chronic usage, are going to definitely improve the performance. And one has to only look at the physique of these boys or men to see how much difference it makes to bodybuilding. However, the moment these drugs are withdrawn, and sometimes that when growth hormone is even continued, there can be myopathy produced by growth hormone. And the moment these drugs are withdrawn, you can have issues of hypogonadism, associated muscle atrophy in steroids. So the answer to your question, do these drugs work? Probably yes. It would not be ethical to do a controlled clinical trial to see whether they really improve the Vmax, and et cetera, et cetera. But the fact that the athletes that who used them in the past, be cyclists, be runners, or whatever they were, they did outperform their cohorts
Yeah,
who
maybe,
probably were not using. So I think.
well, it's my end, but I can't hear Dr. Bipin Sethi.
Sorry, am I not
No,
audible?
so the last part I couldn't hear you. Yeah.
I said that these drugs might have been working. If they were not working,
Sure.
people would not have been able to outperform, but they are not good drugs and they can lead to problems while being used, like growth hormone, or soon after discontinuation.
Right. Okay. Yeah. Thanks. So clearly they, I mean, there is a lot of evidence that they do some good in the short term in terms of sports performance. There will be some question marks possibly still remaining about the use of some agents, but largely the belief is that they are helpful. So we have someone who's very special to us, Dr. Bikash Mehdi, because of his involvement in the National Anti-Doping Agency activities. So there are different substances banned by different organizations. So we know we have our NADA, there is the WADA, the World Anti-Doping Agency, there is the International Olympic Association, and so many. So are there gross differences in the substances which are banned by these different bodies? So what is it in India? Which are the major agents that are banned? Dr. Mehdi.
Yeah, actually, every year in the month of January, World Anti-Doping Agency, they released a list of prohibited substances. So when you go to the list, actually list is divided into two parts. The prohibited substances in all the time, during competition and out of competition. So there it includes the first one is non-approved substances. Like in India, all the medicine, all the drug has been approved by CDS, any new drug. So if somebody is going outside getting a medicine and which is not approved by Drug Controller General of India, automatically it will come as doping. It's happened actually that people had gone to Russia, they brought it, it was kept in a hostel. Second is anabolic steroid. Then all the hormone we talked about, peptide hormone, growth hormone, substances like earlier, the expert had said about beta-2 agonists, then all the hormonal and metabolic modulators, then including the diuretics, which is probably it is used as a masking, but some of the sport it is used also to reduce the weight in a particular category. So overnight they use it. So then when you go to other category like prohibited all the times, so this all comes under manipulation of the blood and blood component. So I also wanted to highlight one more thing is that all the countries, developed countries, they have a system of biological passport. And India also is required because today you say that somebody uses GCSF, somebody hormonal preparation. Okay, we have a players from different parts, like somebody is coming from Leh, which is around 18,000 to 15,000. So how do you get to know that person had taken or not? So the NADA has started a biological passport provision, but otherwise also we have a chemical and physical manipulation could be there. There is also option for gene doping, but we have not received any case till today about gene doping, but obviously we should have a mechanism to identify. Then prohibited substances in competition, mostly it comes as a stimulant. Like you talk about cyclists, we have a case of cyclists who use amphetamine. There is a couple of cases where people have used mucin gel where there are two stimulants, phentermine and mephentermine. So this was actually isolated. And then cannabis, glucocorticoid. Of course, some of the substances are prohibited in particular sports are alcohol and beta blocker, what we had discussed. So this is mainly two divisions. One is during competition and during out of competition. Now, one more point related to India, I just wanted to say that normally when you look at the therapeutic area, particularly fixed dose combination, It is only available many of the thousands of product in India, but in outside there is no fixed dose combination. They only encourage for malaria, tuberculosis, leprosy, or antihypertensive. And because of this fixed dose combination, the problem it comes is you never get to know that, like somebody take a cough syrup, okay? So codeine is there. So they are not aware of it. So even a medical officer is also not able to prescribe the medicine, at least. So we used to tell the athlete, at least you go and tell that I am a national level athlete, district player, whatever it is, so that some medicine you have to check that you should not prescribe. And because of this, another main issue is coming is many of these athletes, they use dietary supplement. And all the dietary supplement, we do not know that how dietary supplement are contaminated, because when you look at any product, it is coming from manufacturing unit, then distribution phase, then outlet. So during that phase, if there is a contamination, so we just tell them that when you buy, just ask that is that it directly coming from manufacturing to retail outlet, and you have a receipt also. So at the time of when you give a sample, you give a declaration, you're taking a dietary supplement. And because of this issue, recently we started with the app. NADA has come up with an app, Know Your Medicine. So basically, you know that when you talk to athlete, many of the athlete, our athlete is coming from the rural area. So they are not aware about the blended generic medicine and fixed dose combination. So there is a UK model. So when you buy a medicine, you enter into the app. If it is coming green, you get to know that this medicine is suitable for it. And if it is coming red, you have an indication you should not take it. So similar app has been developed, and it was actually introduced by Honorable Minister recently. So that also, that all athletes, they can download this. And one should be very careful about the dietary supplement. That also action has been taken. So the government is going to start 2 labs. One is in Hyderabad, another is in Gujarat, to check the quality of dietary supplement. Obviously, I just tell that many times we do not recommend any dietary supplement because you have to do the exercise. But if at all, like there is an Australian model, they put it as ABCD classification. So there is a team who assess what calories required, then only they recommend it. So like that, it can be implemented in India. Thank you, sir.
Right. But can you please elaborate on this biological passport? So
Yeah.
What exactly is that?
What I said is like, this is a typical term is used. Like I have an athlete from Leh, somebody from high altitude from, so moment you go to high altitude, their hemoglobin and, all the parameter is different. So in that situation, like somebody is taking a blood transfusion before the sport, okay, somebody is taking any of this, hormone manipulation. How do you get to know? So they keep the record of all the athlete profile of hemoglobin profile for whole year. So continuously recording will be there. Like you said that one of the athletes hemoglobin level is 15. So that way you get to know that person is coming from, Leh, definitely the profile will be different. So that is what we call it a biological passport. So NADA had collaborated with All India Institute of Medical Sciences, and they started this because all other country, they have this system of biological passport. So you get to know that even somebody take a iron injection coming here, how do you get to know that person has been taking an iron injection or any of the blood transfusion, for example. So that is why it can be detected that there is some changes. It is not physiological. It is from the exogenous. So in the lab, we have a capacity to identify this as exogenous, and that's how we identify. Second point, I just wanted to say that how they different from other country to this country, because we have a lot of fixed dose combination that need to be looked at. Okay, thank you, sir.
Right, thank you. So we have an established system, as I understand, in our country also to detect this. What fascinates me and intrigues me is how do we detect, especially when we talk of growth hormone, when we talk of erythropoietin. So these are all own biological product, which is there in everyone's body. So how do we know whether it's given from outside or it's produced from our body itself? And why should we, isn't there a possibility of falsely incriminating a sports person? So can Dr. Orpandev Bhattacharya highlight on this issue, especially because it relates to endocrine measurements as well?
Thanks, Professor Shivankar. My knowledge in this topic are very much on the hearsay evidence. We do have seen some people who are taking performance enhancing, mainly in terms of bodybuilder. I have a few clients. They obviously they clearly tell that they are taking, and they have a particular protocol going on. Now, so far the assay is concerned, if something is already there in our body, obviously that's differentiation will be very, very difficult. See, in this context, for example, we are talking about the anabolic steroids, androgen. There's one particular thing is called AP testosterone. So that is basically physically it is inactive, but it is a conglomeration of that with the binding protein. And interesting is that testosterone does not convert to AP testosterone or vice versa. And normal ratio is 1:1. So if we are checking a testosterone level, which is say 5 times or 6 times more than the testosterone, then we know that is an exogenous testosterone taken. And then also become a particular problem in this setting. Suppose somebody is a diagnosed hypogonadism, taking a testosterone, whatever form, whether it's a topical or injection or a pellet. So there are a particular time frame is there. For example, if you're taking a patch, you need to do the test at least after 2 weeks. If you're using a pellet, you need to give a good few months before test. But so far the erythropoietin or growth hormone is concerned, I'm not very sure how effectively and efficiently I can detect them separately.
Right. Yeah. So maybe for growth hormone, at least it is suggested that it is genetically engineered growth hormone that's used, and usually that's more uniform in terms of the molecular weight. So in terms of molecular weight, possibly 22 kilodalton growth hormone uniformly is what you expect from exogenous, whereas endogenous is not just 22 kilodaltons, you have maybe others 20 kilodaltons and so on and so forth. Maybe something like that. So I know Dr. Bipin Sethi has another meeting to attend. I know he's very busy and much sought after. So are the others, of course. But this evening, so can we ask Dr. Sethi one more question, and then maybe let him go and enlighten other people in another meeting. So we just were talking about growth hormone, erythropoietin. So what would be the adverse effects of a person taking these?
See, erythropoietin is supposed to increase the red cell mass, and it was already alluded to. People have high hemoglobin, and they can also have tendency to thrombosis if they are dehydrated. This can cause headache. This can cause hypertension. And if you are taking a dirty erythropoietin, you know that there have been cases of biosimilar erythropoietin causing pure bone marrow red cell aplasia. So these are not without side effects. Growth hormone in and by itself can have some issues like volume expansion, fluid overload, carpal tunnel syndrome, hypertension, headache, cardiomyopathy, arrhythmias, issues of metabolic derangements like insulin resistance, diabetes mellitus, dyslipidemia. And there are some potential side effects in terms of it being a growth promoting agent through IGF-1. So maybe tumorigenesis, which has also been reported with erythropoietin. So these are not very safe. And as I said, though there is some muscular hypertrophy, continued use of growth hormone can lead to muscle atrophy also and decrease in the muscle performance. So there are a lot of side effects with these agents, both erythropoietin and growth hormone, and they need to be looked at, and people need to be aware of those side effects.
Need to unmute.
Shivankar, you need to unmute. Yeah.
Am I not? Yeah. Now,
Yeah.
yeah. Okay. So maybe we turn to Sanjay. We haven't heard from him so far. So Sanjay, so one of the issues about growth hormone, for example, because we were talking on growth hormone, is how do you make out, even if you can biochemically, immunoassay or spectrometry or whatever by method, you can differentiate between different forms of growth hormone, but the action is relatively short lasting. So how can we make out that this individual didn't take growth hormone maybe 2 days back or 3 days back? Is that possible?
Yeah, I think it may be because because the IGF generation or IGF BP3 level might be helpful, but I'm not sure that really we are able to differentiate that the IGF-1 taken from outside versus the endogenous. But maybe level can be different, or IGF-1 level might be helpful, because if the normal person IGF level will be okay. On the contrary, if the IGH is taken recently, the IGF-1 level might be high, or maybe binding protein, which is a longer half-life. We can measure that. That might be of helpful actually.
Right. Now, one of the commonest abused substances, I think, is anabolic steroids. And would you sort of make us aware of the potential adverse effects?
Yeah, because anabolic steroids are very widely used, especially the Chandigarh is the place which is of the capital of the two states, Punjab, Haryana, and Chandigarh itself is UP. So a lot of patients we do see. And another misuse is not done in the athletics, but that is done in the by the what we call gym people. They are
Yeah,
giving
absolutely.
left and right. So instead of sports person, this is more frequently used by the gym person. And the what I have come across, the important side effect is that one is developing the renal failure, and the patients require the often biopsy to ascertain the cause of the acute renal failure. And the FSGN is one of the non side effect of this anabolic steroid. And then another problem is that especially in the females, they having all the features of the androgen axis in form of hirsutism, in form of PCOS, in form of frontal baldness. And similar is also observed with the baldness in the male patient also, as well as the gynecomastia. So these are the very immediate side effects of these on the reproductive organs because of this. But the long-term complications are there in form of cardiovascular involvement or hypertension, or like erythropoiesis can also increase the what you call hemoglobin level or kind of polycythemia kind of situation. And as well as it is known that these drugs can cause the rise in the liver enzymes, maybe cholestasis, as well as the rarely the pediasis hepatis also, or in the long term it can cause hepatocellular carcinoma. So these are the various other long-term, short-term effects, as well as different in the male and the female. Like in male, they can have the gynecomastia, and the female, they might have the breast atrophy also because of the androgen. Of course, the menstrual cycle irregularity is another one. Maybe they are taking it as a sports person, so very busy or involved in the physical activity, that may be a cause, but actually, on the contrary, there's anabolic steroids are causing all these problems.
But gynecomastia, is that a common problem? Is testosterone itself used, or these anabolic steroids, are these aromatizable?
Yeah, maybe.
Otherwise, would they cause gynecomastia?
So mainly, if they use the testosterone, that may be one of the major issues. Not with these other anabolic steroids, not that common. What we can say.
The other issue I understand is suppression of spermatogenesis, as well as, I mean, decreased libido because endogenous testosterone goes down. But how long can this persist? If someone stops, can this persist for indefinite periods?
It can persist for at least 6 to 9 months, because these are all hormones actually stored in the fat and that comes out slowly. So it can persist for few months at least. And many changes are actually irreversible also, because say suppose the female patient is given anabolic androgens, then there is may change their voice actually. And we have seen few patients the change in voice, this some of the athletes. So that is also another problem. And infertility, indeed, one of the person is a gym instructor. He came to us with the complaint of infertility actually. Then we just asked history, and he said that I was taking this for a longer period of time. So that is another side effect of infertility is there, or maybe loss of libido also.
Right. So, Arpan, there's a question in our chat box from one of our participants. Unintentional use of dietary supplements by athletes is very tricky issue. How can we as a doctor understand and guide someone who comes to us for guidance on whether to take a particular supplement or not? Maybe Dr. Mehdi had answered part of
Yeah.
it. But,
I think Dr. Bikash will be the better person for.
So,
Okay.
yeah. Can I come in?
Yes, yes.
So question regarding dietary supplement, normally we do not recommend dietary supplement. Nobody, no authorized agency, they recommend dietary supplement. It's all depend on, because many of the athletes, they have a belief that whatever food they take it, so they need more than that. And that is why they started taking a dietary supplement. But what we advise is when you talk about dietary supplement, we should make sure, because we do not have that regulated, that if there is a contamination, maybe athlete is honest, but there is a contamination, and because of that, that person come positive, dop positive. But when you look at the code for anti-doping code, it is the athlete who need to explain ये आपका body में कैसे आया. So that is why what we advise is whenever you decided to go for a dietary supplement, make sure that you have a documentation that where you brought it, batch number, license number, everything should be there. And we also advise that it should be directly come from the manufacturer to retail outlet, so that there is during the distribution, if something happened, you never. So as I said that we're going to have a check for quality. Government has already started a lab, and that is in Hyderabad, Naipur, and that is in Gujarat Forensic Lab. So this need to be streamlined, and they have already signed an MOU with FSSI, Food Standard of India. So,
But how, as we doctor, how can we make sure that it comes from the manufacturer to retailer directly? I understand your point is very clear, but how, the question is like that, as we are seeing a practicing doctor, how can I make it that it has come directly from the manufacturer to the retailer?
We actually create a awareness among the athlete that when you buy, that you get a receipt of what you buy, and what is a batch number, what is a license number of particular dietary supplement. So at least they can say that we have used this particular batch, so that next phase one can be done from the regulator. They can take the same batch and they can go for an analysis if there is a contamination. That can be done.
Okay. Okay. So Dr. Mehdi, one more for you. So why are random athletes testing only done, not for all? Is it cost, feasibility, or any other issue?
No, nothing like that. Actually, we have around 130 dop testing officer, team. So they are mostly in the science center, nearby science center, Sports Authority of India, or any event they are going to organize. So normally we take it randomly, but this is also one important point is that definitely people ask that why my sample has been taken. Sample is taken, in case of during competition, and in case of out of competition also. Somebody is sitting in a home. So that is why athlete, when they move one place to another, if they have shifted the house, they immediately have to inform the NADA. Otherwise, it will be considered, if the dope officer go there and person is not there, it will be considered as dope violation. So we have 2010 code, so where it says that presence of prohibited substances if you are helping attempted, these are code are there. But there is also 2015 code where additionally it has been included that if somebody advise, because normally when anti-doping panel, when you ask, "Aapko kisne bataya?" usually answer is comes from the senior and post. So then if it is like that, and now with 2015 code, they are also accountable for a violation. So we have a, NADA has a intelligence unit also, like people from CBI, people from police, they also work. So if you get an information that somewhere it is been practiced in a school or in a particular event, so selectively you can go and take the sample also. That is also the 3 categories.
Okay, good. So we have another question from one member of our audience. Of course, I wasn't aware that recently cricketer Prithvi Shaw got banned due to cough syrup containing terbutaline. Is that correct? Was he banned?
Yeah, actually, it was trying for a long time to come under the doping prohibition.
Terbutaline.
Yeah. So any codeine is there. So you have to see that what are the ingredients. So many of these
Right,
cough
yeah.
syrup or ingredients are there, but if we prohibited substances there, then definitely it will be considered as low cost.
So my question is to Dr. Shubhankar Kumar. How does terbutaline, if we assume that terbutaline is a offending substance, but of course, Dr. Mehdi suggested codeine could be the one. So how does terbutaline affect performance? Could it affect performance? Meaning improve performance.
Dr. Shumar Kumar, your audio is mute. If you could unmute yourself.
I really don't have an answer. The best guess I can offer is it accelerates the heart rate, and heart rate is the main mechanism of increasing cardiac output in exercise. So that could be the way it works.
Okay. So quick
Can I-
question for Dr. Mehdi. Yes. So
Yeah.
is terbutaline on the banned list?
Yeah, because in some sport where it will help in, getting that oxygenation, so definitely it will not be allowed. Like we ban all these, beta 2 blockers in a shooting because it will reduce the tremor. So that is why. So case to case basis, it is banned.
Right. So we come back to Dr. Arpan Dev. So your guidance on our young adolescent sports persons, as nowadays they get exposed to international platforms quite early. And
Very interesting. I think in whole this cycle, and this competition is going on to do better than the others, all of our interested. So I think the responsibility will be for the team coach, manager, and the team doctor. So at the end of the day, athlete will be responsible for whatever wrong is done, whether they are done intentionally or accidentally. But I think the team has more importance. And our idea will be to make them as much aware possible about the doping. But fact remains they are very young. And most of them concentrate on the sports so much that they didn't go for the so-called formal education with due respect for a long time. So I think very difficult to make a direct comment on that, but whole team should be knowing. Particularly, my more intention will be coach and the team doctor.
absolutely. So Sanjay, so this may not directly relate to endocrinology, but we all know a few years back, Maria Sharapova was pulled up because she had taken something called meldonium, which was apparently a drug to be used for cardiac conditions in her country. Whether she lied on that, of course we don't know. So, do you think it's fair if someone's taking something for treatment of a condition, and then she's banned from sports or stripped of her title? Is that not going overboard?
Yeah, I think at least for like she was caught with the miltronate or meldonium, which is actually a kind of not actually a drug, but something kind of supplement. And even the mechanism of action is not clearly known that how it is going to benefit that. Though I was just looking for this drug in the Goodman-Gilman, but I could not get that drug in that textbook also. So it means it is not widely available. And I'm sure it is not available in India, maybe. And Dr. Vikas is pointing finger that he will give him chance
Okay.
to answer.
Yeah.
What we mentioned about this drug is that even found that the testosterone level increases with meldonium, that is mentioned, and that drug is mainly used for the recovery, fast recovery from the exercise. And what she was, she informed that I was taking because I have a family history of diabetes and the heart condition. So that's why I was taking from last 10 years or so. So in fact, we cannot pass a judgment here, but I think if every year such a senior player, every year she knows that there is a list is declared by the WADA and she should look at it, that it is this drug is banned or not. So if it is there and she has not gone through that and she was taking, so she is on fault. Of course, there is no doubt about it because the list is declared every time. So over to Vikas.
Yes.
Yeah, like we have a lot of cases. I cannot disclose, but I'll just give you one example how people have used it. Like normally we have a preparation of mucin gel. So we have a case of people say that I have taken a mucin gel because I have a gastritis, dyspepsia. But when you look at kinetically, we could find that the kinetic profile is injectable of the two stimulant which is there in the mucin gel like phentermine and mephentermine. We have been doing
So,
a studies
so
also.
mucin gel, does it contain
Yeah,
phentermine?
CNS stimulant, one is phentermine and mephentermine. So if you look at the data, we have only studies from Taiwan. So with coordination with NTDL, we have been doing a study almost completed. So these are example. Like another example, you can say that there are a lot of drug they use which is not in clinical practice. It is outdated, and we do not know how they get that medicine, because when you look at medicine which is totally last 50 years, nobody has used it in a clinical practice. And that is why in Western setup, they have a mechanism that, like I'm a IND member, so I'm in a drug regulation. So every month we approve 4 to 5 drugs, almost every month. So in that situation, that they have a mechanism that when during the drug development, if they find that this is going to enhance the performance, they already inform that particular National Anti-Doping Agency or that lab, so that they can come up with a method, because suddenly a drug come, nobody is going to perform the test. There is no validation of test. So that is why they practice it, that they are ready with a test, that if the panel of tests a new drug approved, they're going to do it. And that's a mechanism has been implemented.
So this evening, our most important resource person has been Dr. Bikash Mehdi. So we come back to you. So where are the centers in our country where these tests are being conducted?
Yeah, like you say that now the provision has been changed, and you can see the Parliament Act has been passed for the dope testing lab. So we have only one lab that's in Nehru Stadium, that is called NTDL, National Dope
That's in
Testing Lab.
Delhi.
That is in Delhi. So
Right.
all the sample when we collect it. So when we collect the sample, it is type A sample and B sample. So it is like you will be given opportunity to athlete that will collect the sample.
Right. Sorry to interrupt. So is it only urine sample or
No,
is it blood sample?
It could be a urine sample. 90% of the cases is urine sample, but it could be blood, or it could be any of the biological. We can take the saliva also. But usually 90 majority cases is urine sample. So when we collect the sample, it is like there is a specific container is there. Okay. So they'll seal in front of them, because there could be a lot of allegation कि किसी ने मेरा sample में कुछ डाल दिया. So when we do the A sample into the lab, and if it is coming positive, then we inform the athlete that your sample has come positive. You come to the lab, in front of you, we'll do the B sample for a confirmatory. Many athletes say that I don't want to participate. So then it goes to anti-doping panel for a deliberation. What situation that because there is a form, and this is very important if participants are athlete, that please remember that form is very important, because every piece of information you have to declare. Because many times when we discuss in the anti-doping panel, you say that I've been taking a medicine, doctor has prescribed a medicine, but in the form they did not write it, so it will not be acceptable in a national player or in a district level player. Okay, if it is somebody is coming from the rural area, ignorant people, then there. So we have only one lab, but it is very important that this lab is accredited by WADA, World Anti-Doping Agency. So otherwise, because whatever case we discuss, immediately one copy goes to WADA. So we have to perform as per the WADA code, that whatever decision you're going to take about earlier 2 years, now it is 4 years, so that all are scrutinized by World Anti-Doping Agency. So we cannot go out of this, because we have to follow their provision. So similarly, our lab was not working, so all sample were referred to Doha. There is another lab in Doha. Then our lab, every lab, a global platform, there is a reference lab. So our reference lab is a colon. So suppose you go to the lab, that they put the question, like we go for NABL, we go for LAC, there are different agencies, ISO we maintain. But ultimately, WODA is going to approve, then only you can do the sample. So our lab is, Antidale is approved by WODA. But as I say, the Parliamentary Act has been implemented. I think there is a provision to have all the zonal lab. It is going to create in every zone, like maybe North zone, South zones, like that. Like we have a CDL for drug testing. So same thing, but Epic's lab will be Antidale in India. But otherwise,
Right.
many times athlete actually go to international court also.
Okay.
Okay, because
Right.
they might claim that this is not done properly. So during that
True.
time, also we can go for a reference. Thank you.
And just for our interest, so what is the method of detection?
So we
Which
have,
assay?
yeah, but like you can see that when you go to the lab, there is an SOP. Okay, so they go for all panel of tests. All systematically they'll go for a panel of tests, see, and that's how they will do it. So basically, they'll generate the blinding, and once it is goes, sample is packed, shipping, and then when it is reopened, the documentation is done, and there is a result management section is also there after the test. Okay, so all the tests will be done, all the drug, like what I said is during competition, out of competition, all are banned. So that way they'll go for it.
Right. So I think we have had an interesting discussion, and we have had and I'm provided this data every day by Mr. Amit Arora from Intas, that at least 800, more than 800 doctors are actually live watching and learning from the wisdom and knowledge that you are sharing. So maybe we wanted to wind up, but we have one more question in our chat box. So as discussed many times, doping tests are done after the sporting event is over. Are there any specific doping substances which cannot be picked up in samples after a certain period of time? Maybe we discussed a little bit about it, but Dr. Bikash Mehdi once more.
Yeah, actually the provision of taking a dope sample is those who get a medal.
Okay.
Second is coming randomly, and third is target. So that is why, like, there's a routine checkup. As I said, that somebody is sitting at home, they are not in competition. There also we take the sample. So these are provision are there. It's just not that it will not be detected. It will be detected. I'll give you one example that many of the people, they have a belief that they take a medicine, doping agent, and they take a diuretics, thinking that it will be eliminated. They use as a masking agent. But here if you say that we have a technique of detection till 1 picogram, 1 nanogram. So even it is eliminated, like we say drug is eliminated when you multiply by 10 elimination half-life. It is only eliminated 90.9, 99.9, but 1.1% is there. From there we can detect it, that person had taken. And those who converted to active metabolite, so we can also go for a metabolomics, because many times, the drug is converted, but active metabolite, you get an effect. So there also can be done a metabolomics, that metabolite we can detect and say that person had taken like that.
Right. So
I think it is must in the, at least those are getting the medals.
Yeah.
Sure. For
So
them.
that is all medal, because you might seen that we have seen the cases when we request that can you give the sample, they started running in another corner. So you get an idea of what is going on.
okay.
That is why we actually in a science center, we tell them that that athletes should be trained how to talk to them, because there is a provision of giving sample. Like you can allow up to 15 minutes, for example, hypothetically. So they can say that I have received a medal, let me receive the medal, then I'll come back to you. So that also training we give it, that because they should not get scared of. Okay, so they can give the sample that, but you can politely talk to the dope control officer that मुझे थोड़ा time दीजिए, मैं medal लेके आपके पास आता हूँ.
Right. So there's a huge world which is commercial also, and which is health effects, and possibly improves, as Dr. Bipin Sethi suggested, that possibly there is some performance enhancing effect, but there are so much of adverse effects as well. So we should also all be aware, as physicians, as parents, as relations, and just as sports people are getting smarter and smarter, going for agents which are more difficult to detect. Dr. Mehdi tells us that the system also is getting smarter to detect these agents more efficiently. And we may wind up with maybe the knowledge suggestion that we should take sport sportingly, try and be honest, have the right spirit of participation, and also have the right spirit even if we lose. So, participation itself is important, and we should train ourselves properly. And again, I think Dr. Orpundip made a very valid point that it's yes, sir. Dr. Mehdi wants to have the last word,
just
and he
because,
will have
yeah,
it. Yeah,
yeah,
no,
just
so
wanted
what
to
I was
convey that very important message to the all athlete that whenever somebody falls sick, there is a provision called TUE, therapeutic use exemption. So all of you should know that whenever you fall sick, immediately you can apply. If somebody is had an accident, unconscious, they can go for a retroactive TUE also. So there is a committee who justify for use of any prohibited, like you have a child having growth hormone deficiency. It is justified to give a growth hormone, though it is prohibited. So people should know it, how to use the TUE, therapeutic use exemption. That is what I wanted to say. Thank you, sir.
right. Yeah. And Dr. Orpundip very correctly pointed out, I thought that we cannot put all the blame on the athlete only, and it's very often it's the team manager, coach, or whoever. They goad the athletes into taking these agents. They also arrange for getting these agents. So they
Correct.
all, everyone should play a more responsible role, so that we see less and less of this menace in the sporting world.
Patients are taking IGF-1, so otherwise
Yeah,
I
yeah.
is not approach to endocrinologists, but they are
Yeah.
getting IGF-1 from somewhere from China or something like that. So that is also very interesting area, that how people are getting these commonly not available drugs. And indeed the coaches are telling, if you want to win medal, then you have to take this. This is the might be now things are changing, but otherwise earlier this was the kind of.
See, I believe this pressure is from everybody, from organizer to sponsor to coaches to athlete, from us also. We also want our idol to perform much better and better and better. So they are also stressed out. I think Dr. Shovankar's camera connection is a bit frozen.
Yeah, internet is slow, I think.
Dr. Vikas, suppose like somebody is taking, animals are given estrogen or oxytocin to improve the.
Right. So, Dr.
Yeah. So what is the solution for that actually?
Actually, any of the peptide, when you give orally, so it will be degraded, so it will not have any effect. So that is why. I think many people, they ask, and they also claim.
Estrogens.
For bone health actually. Oxytocin is
Yeah,
very good
definitely.
for bone health, and it is proven that animals, those are given the oxytocin, they have the more bone mineral mass actually.
So that has been widely used, and there is a committee is also been considered. Actually, I happen to be chairman for that committee. So it is in the court, so I'll not comment on it. That's the Supreme Court.
Okay.
Okay, so thank you, all of you and all our participants for showing the interest in a slightly offbeat topic, and also it gives us an opportunity to learn more about it as endocrine.
One question should be there in DM exam, sir.
Yeah.
So that
actually normally we put it in MD pharmacology and DM.
And so it's back. It's yeah. Sorry. I can't hear, but so back to the organizers for the final words.
Yeah, good evening, doctors. Particularly, I'll take up from where Dr. Shubhankar Chaudhary had left. Sir summed it up saying that it's an offbeat topic we try to deal with today on doping in sports. Most of the time, when we have come across this topic, it is more from the ethics point of view. But today we got an opportunity to deal with this from the various facets about doping in sports, whether it was from the the endocrine effects of it, the side effect profile, the challenges posed by the fixed dose combination in Indian situation, and the contamination in the dietary supplement, which puts the sportsman in the spot. Thankfully, because of Dr. Bikash Medi, we could actually get into much further details on the government's intervention and the innovative steps being taken from the apps to the documentation. And Doctor also introduced us to, very interesting terminology on biological passport, which I'll also try to read upon more. So that was very interesting, Doctor. Thanks a lot. Your presence significantly value-added the entire session. I'd like to individually thank all the doctors, particularly Dr. Bipin Sethi, Dr. Sanjay Badada, Dr. Arpandev Bhattacharya, and Dr. Shubhankar Kumar for sharing their insight on this topic. We are deeply indebted to Dr. Shubhankar Chaudhary, as always, for curating very intriguing topic. And every time Doctor comes about with a new challenge for the panelists with very interesting topics, and which keeps our audience hooked on to the Endocrine Talk Show. Today, even we have crossed 1,069 participants this evening, and I'm thankful to each of the doctors who have, consistently they have been spending their weekends with us. And thanks to each one of them. Wishing you all a very great weekend. Thank you, doctors. Thanks for your insight during the session. Thank you.
Thank you. Very good night.
Thanks. Good evening. Good evening and good night to all of you. So thank you.